Today's topic is deglutition. Deglutition is also known as swallowing. It's a series of coordinated muscle contraction that moves a bolus of food from the oral cavity through the esophagus and to the stomach. It is an important function of the stomatognathing system. The stomatognathing system is a system which comprises of the teeth, periodontal ligament, temporomandibular joint, tongue and muscles of mastication. Now there are three types of deglutition pattern. The first one is infantile swallow, adult or mature swallow and retained infantile swallow. Infantile swallow. This usually occurs in the infants. When the infants consume their food, they consume by suckling and swallowing process. The suckling and the swallowing process will comprise of caving in of the cheeks, bobbing of the hyoid bone, and the tongue will be elongated with anterior mandibular thrust and the lips will be pursed around the nipple with the head extended. Now, adult or mature swallow. The adult or mature swallow usually occurs after 18 months of age. The features of this swallow are that the teeth will be placed together, mandible will be placed by the muscles of mastication, tongue will be placed towards the palate, behind the incisors and above the incisors, and the contractions of the lip will be minimal. Now, the abnormal type of swallowing is the retained infantile swallow. This usually occurs when there is a failure in the transition from the infantile swallow to the adult or mature swallow. The features of this swallow are jaws will be apart while swallowing, tongue will be placed between the teeth, mandible will be stabilized by the contraction of the lips and tongues, muscles of facial expressions will be involved, there will be nodding of the head, anterior mandibular thrust will be present and caving in of the cheeks. When there is retained infantile swallowing, there can be tongue thrusting that can lead to severe malocclusions. There can be anterior open bite and posterior open bite when there is lateral tongue thrusting, which can lead to poor occlusion. The tongue thrusting can be corrected by correcting the position of the tongue as well as the posture of the tongue. This can be done by myofunctional exercises such as the 4S exercises, where there is identifying the spot, salivating, squeezing the spot and swallowing. There can be also speech therapy such as repeating the words starting with S, multiplication table of 6, etc. There can be fixed or removable appliances used in order to restrain the movement of the tongue towards that of the anterior teeth and to force the tongue downward and backwards. Removable appliances such as the tongue grip and double oral screen can be also given. Thus, deglutition plays an important role in orthodontics. This is because if it is not proper and is retained infantile swallowing, malocclusions or habits like tongue thrusting can develop.